Good afternoon, everyone. Thank you so much for coming. I'm here today to announce that I've appointed a new member to the Alberta Health Services Board and designate him as chair to lead the board. With me today is Mr. Gregory Turnbull, QC, who has agreed to take on the responsibility of serving the AHS board as its new chair for a 3-year term. I'm confident that Mr. Turnbull can lead AHS through the expected and unexpected challenges of today and those that lie ahead. He's proven himself as a leader who understands that building the capacity of an organization requires building capacity of its valued people. He's done this for more than 35 years as a director, officer, and counsel to numerous boards, including boards in the healthcare sector. In getting to know him, it's clear to me that Mr. Turnbull approaches decision-making with a duty of care and understands that the healthcare experience and outcomes for Albertans is mostly about the skill, compassion, and understanding they receive from our frontline staff. With this in mind, Mr. Turnbull is a right person to serve AHS and its staff of more than 100,000 healthcare providers. We have some of the best healthcare providers in the world right here in Alberta, and I recognize the overwhelming challenges they've faced over the last 21 months. So thank you to every healthcare provider in our system for stepping up during the pandemic. You're the foundation of our healthcare system, and it's a privilege to serve as your minister. The pandemic has been a tough journey for every Albertan and for everyone in the healthcare system. And as health minister, I'm committed to guiding and supporting AHS through the current crisis and helping them prepare for the future. The most critical need is building our health system capacity. From beds to staffing, the resilience and capacity of Alberta's healthcare system and workforce must be strengthened. Winning our battle against COVID-19 will relieve much of this burden, so getting more Albertans immunized as fast as possible will continue to be our most important strategy against the virus. But getting vaccinated, we look after ourselves, our communities, and our healthcare workers who look after us. We also need to prepare our health system to respond to future waves of COVID-19 or any other healthcare crisis, so Albertans and healthcare providers do not experience the stress that they've gone through. And we're ready to meet both the health needs of Albertans today and the challenges of tomorrow. I've discussed these priorities with Mr. Turnbull and given him direction that supports our healthcare providers and puts meeting the health needs of Albertans at the center of everything that we do. In particular, we've discussed how Alberta, like other provinces and other countries, has had to postpone scheduled surgeries to maximize capacity in our ICUs. Postponements are a major concern, and my heart goes out to all Albertans and their families who've had their surgeries postponed. They add to the burden on patients and families, and they mean more people are waiting for scheduled surgeries. We're watching the waiting list closely, and as you'd expect, it's gone up over the past few months. In February of 2020, before COVID arrived in Alberta, we had about 68,000 people waiting for surgery. Then we ramped down the system drastically because we didn't know how bad the first wave would be, and by May the list was up to 77,000. AHS worked through that increase in the wait list, and by this past August, we were back down to 68,000. And I recognize this is still too high. So where are we at today, now that we're most of the way through the fourth wave? As of December 6th, the waiting list is about 81,600. So that's an increase of around 14,000 Albertans. The total number of patients waiting has actually been stable for the past month. It was about 81,400 a month ago on November the 6th. So this appears at this point in time to be the peak. As long as we keep COVID under control, we can start to work the list down from here. Now, that is going to be a major job, make no mistake. But quite frankly, it's doable with the support of the teams of physicians and staff who've worked so hard with their patients over the past 21 months and continue to serve Albertans right now. This is a big system. AHS did about 290,000 surgeries a year before COVID. They've already recovered from a big drop in surgery volume once, and quite frankly, I know they can do it again. We're not just asking the same teams to do more. We're going to add capacity in 2022 through the Alberta Surgical Initiative and do more surgeries than ever before. and this is one of the key mandates given to me by the Premier. And I'm working with AHS to get surgery volumes back to 100% normal within the next few weeks, and then continue to increase from there. I'm hoping to have the wait list back down to 6,000 to 8,000 sometime in mid-2022, and then support AHS in continuing to do the catch-up from there. That is my job number one, apart from the response to COVID, of course. It's our government's promise to Albertans, and it's my promise. We are going to bring that waiting list down, and we're going to be focused on bringing scheduled surgeries and make sure that they're done in a clinically appropriate time. But we'll have more to say on this in the new year. We're working on a plan, but the specifics depend on keeping COVID cases low, and the Omicron variant adds another layer of uncertainty. But this will be a top priority for Mr. Turnbull and the AHS board and the AHS team as we move into the new year. The preparation for our plan is well underway between AHS and my ministry, including expanding and adding new operating rooms across the province in Calgary, Edmonton, Edson, Grand Prairie, Lethbridge, Medicine Hat, and Rocky Mountain House. In Budget 2021, we committed $120 million in annual operating funding for the Alberta Surgical Initiative, plus $120 million in capital funds over the next 3 years to reduce wait times and to improve the entire surgical system. The new chair's priorities will also include improving access to health services for people in rural and remote parts of the province, including Indigenous communities, so all Albertans have access to the care that they need. I've also instructed Mr. Turnbull that we must continue addressing the volume increases that emergency medical services are experiencing and expand Albertans' access to mental health and addiction services. These are just a few of the initiatives that Mr. Turnbull will focus on with the board and with AHS over the coming months. I welcome him to the AHS board and appreciate the experience and regard for staff that he brings to the table. I also like to extend my sincere thanks to all AHS board members for the continued service, and in particular, David Wyant, who's moving on to other endeavors. This pandemic has been a tough journey for all Albertans and for everyone at AHS and across the wider health system. I've heard firsthand the experience of fatigue, of lives lost, and challenges that sometimes seem insurmountable. Those experiences are important to me, and I know they're important to Mr. Turnbull. We need to care for our healthcare workers to help them care for us, as they've done through the pandemic, and they've always done and will continue to do. I look forward to continuing to work with the board and the leadership team at AHS to get through the fourth wave, to build capacity and minimize disruption of care if we see any future waves. So thank you again for coming today, and it's my pleasure to ask the new AHS board chair to say a few words. Greg, over to you.
Well, thank you. Excuse me. Thank you, Minister. I'm honored to be here and to be chosen as the new Alberta Health Services Board Chair. Thank you for the privilege to lead the board of this organization, which supports Canada's first province-wide, fully integrated health system. And it is responsible for planning and delivering health supports and services to more than 4 million Albertans. I also want to thank Dr. Verna Yu, her management team, and every AHS staff member for their dedication, professionalism, and hard work, particularly during these challenging times of the COVID-19 pandemic. AHS staff have been and continue to work tirelessly to improve Albertans' health and well-being and provide high-quality health care. I join the Minister in thanking them for everything they do for Albertans, and I will champion their heroic efforts each and every day. Just let me share a little bit about myself. I have a legal background going over 40 years in Alberta and a wide range of experience being a director or officer for more than 40 public and private companies. My experience with legal, financial, and corporate governance matters, I feel, will serve me well on the AHS board. Through the many years that I've worked on corporate governance issues, I have focused on people and staff. But my focus has not just been on business matters. I have been inspired throughout my life by the challenge given by President John Kennedy in his 1961 inaugural address, when he stated, "Ask not what your country can do for you. Ask what you can do for your country." Giving back to our Alberta community is something I try to live by. I have been chair of the governance committee at the Calgary Health Foundation and chair of the Calgary Zoo, which I may say helped me when I was managing my law firm. And I currently sit on the Dean's Advisory Board at the Cummings School of Medicine and on the advisory board to the School of Public Policy. Service is part of my life's mission. I truly understand that health is first and foremost a people business. It is a field where caring and compassion are of prime importance, and where special people who want to make a difference are dedicated to improving Albertans' lives. I am proud and humbled to be part of this outstanding group of individuals. As I take on this new role, I intend to work with the Health Minister, the Board, Dr. Yu, and the AHS leadership team to implement the priorities the Minister has mentioned, including enhancing health system capacity as we respond to both the pandemic and the increased demand for health services in our province. I give you my commitment to lead the board to the best of my abilities and to support AHS in fulfilling its mission to provide a patient-focused, quality health system that is accessible and sustainable for all Albertans. Thank you very much.
Thank you, Greg, and thank you, Minister Copping. This concludes the formal portion of today's announcement, and we'll now be moving over to a Q&A with the media. We have one person who's joined us in the room here today, so we'll defer to them first. Could you please just state your name and the outlet you're with prior to asking your question, as well as who you're asking your question to, whether it's Minister Copping or Mr. Turnbull. Thank you.
Yes, thank you. This is Jordan Canigan with CTV News for the Minister. A couple of questions. I do appreciate that you just talked about surgical delays, but there was a report out today from the Canadian Institute for Health Information saying that Alberta has performed 2,800 fewer surgeries per month on average for the first 16 months of the pandemic. That does not include the fourth wave, where, of course, thousands more were canceled. What more do you say to the patients and the families who have had delays in their surgeries? Some of them say it's been delayed to the point now where it may be too late for them to get a surgery that makes a difference in their quality of life. And when may Alberta catch up to that backlog?
Yeah. Well, thanks for the question. And you know, to families who have had their surgeries postponed and individuals, you know, my heart goes out to them. It is a challenging time, and as we've all struggled with getting through with COVID. I do note in the report that you're referencing, they found that, you know, this problem that we faced in Alberta is not unique to Alberta. It's actually across the entire country. They found that surgery volumes in Canada overall dropped by 18%, not including Quebec. In Alberta, in regards to the first three waves, it was only 8%. So our system is actually, you know, even though it dropped, but as I mentioned before, by August, we caught up on the wait list, although some of the times were still out of scope versus in scope in terms of the suggested clinical times associated with that. But it shows that our system is resilient, that we were able to recover the first 3 waves. So we're going to be doing it again in the 4th wave. But we also have moved forward a number of initiatives like the Alberta Surgical Initiative, RFPs for additional capacity in orthopedics, for example, and we're moving closer to be able to finalizing that, plus leveraging our public system to do more done. So we've done it before. We have more capacity to do it again, and that's what our focus is going to be. So again, my heart goes out to Albertans who have been impacted. But and one of the reasons we're doing this announcement today, and with our new board chair, is because that is going to be our focus. It's going to be a focus of my ministry. It's going to be a focus of the AHS board, and quite frankly of AHS, to do everything we can to get caught up on the surgeries and ensure that the Alberta patient is at the center of everything we do.
And just one more separate question. It's about rapid antigen tests, take-home tests. There's been a growing call for the government to make those more available to the public to take home, especially ahead of the Christmas and holiday season. Will the province be making those tests more available to members of the public?
Yeah, so we are looking at this issue right now. As you may be aware, we've already distributed 7 million tests in Alberta through Alberta Health, and to use it as a screening tool. It's important that it be used in the right context, because in certain cases it actually works very well, and others can give you, false negatives because it doesn't pick up as much. That said, we are looking at how do we make this more widely available, and all I can say is decisions are being made as we speak, and stay tuned. So.
Thank you. We'll now move over to the phones. Operator, can you please put through our first caller?
Thank you. The first call is Jesse Weisner, Global News.
Hi there. Thanks for taking my question. This is for the Minister. I'm wondering if the COVID committee has mapped out any holiday restrictions during the meeting today, and what Dr. Hinshaw's recommendations have been around loosening restrictions before Christmas.
Yeah, so that, as Dr. Hinshaw, I think, mentioned on Tuesday, these issues are still under consideration at this point in time. On the one hand, we have some, continue see positive trends in terms of cases declining generally, as well as a reduction in ICU, reduction in the number of COVID cases within ICU. That said, we're still sitting at roughly about 110% of normal capacity within our ICUs, and then Omicron is a concern. So we're looking at this data very closely. We're continuing to have discussions, and then hopefully we'll be able to update Albertans in the near future.
And Jesse, do you have a follow-up today?
I do, just in regards to that question. Is the COVID committee meeting today, and are they meeting right now, or what is the timeline on that? And on a different note, there's been some concerns raised about the new digital overdose response system app. With the overdose public health emergency at hand, what's your concern level about the issues, and are you aware of any actions being taken to rectify them?
So on your first question, there is no specific meeting today. That said, we are looking at the issue in terms of when might it be appropriate to make changes, recognizing that we have a number of factors. Some suggest some trends heading in the right direction, others that are a concern. But our focus will be caution as we move forward, and we'll be able to talk more about this later. In regards to the opioid crisis, fully appreciate the concerns. This is an important issue. In fact, my colleague, the Associate Minister of Mental Health and Addictions, that is his whole focus on how do we actually manage this. And we have actually put, as you know, additional funding for treatment spaces. We also are looking at, he's rolled out a strategy, and we continue to work on that. So in regards to the specific of the questions, and we have my staff get back to you in regards to the particular app and then how that's working.
Okay, thank you, Minister. Operator, can you please connect the last caller that we have on the line today?
Jamie Dahl, Global News.
This is for the Minister. Just to follow up on that, do you know, though, is the app effective? There's a number of people that are coming forward saying they don't recommend anyone to actually use it. And do you have any data to know just how effective it's been or how many people are actually using it?
I would encourage questions on the Drug Overdose Response System app to be directed to the Ministry of Mental Health and Addictions, which is running the file. If you have another question, you can happily ask, but this is the Ministry of Health, which is part of that file, but the Associate Minister is the one taking the lead on that. Thank you.
Do you know if children that are vaccinated, will they be required to quarantine for the 2 weeks and not go to school if they should travel?
I'll have to get back to you on those specific rules on the traveling, because that's a federal requirement in terms of whether it applies to actually children. So we'll have staff get back to you on that detailed question.
Okay. Thanks, everybody. That concludes today's announcement.